Welcome to Your Life. I'm your host, Dr. Anna Marie. You know, shoes are an addiction for many women, but could you imagine having nip and tuck surgery just to squeeze your foot into bad boys like these? Well, we're going to kick off this week's show by taking a look at an alarming trend in our country: cosmetic foot procedures just to wear trendy shoes. But we're going to see this issue through the eyes of a woman who turned to surgery because of some serious pain.
Hundreds of shoes. I love shoes. And this has been the last couple of years have been the year of the shoe.
But fashionable shoes are a thing of the past for Mary Celebree. These days, the 59-year-old nurse keeps this bag of shoes by her side, just hoping to find a moment of relief from pain. It all started about 8 years ago when Mary was dealing with a bunion and hammer toe in her left foot. She dealt with the pain as long as possible, trying to avoid surgery, but when it became unbearable, that's when she had her first surgery.
Someone had suggested that when you have foot surgery, it's like a domino effect. And if you have one toe done, then it just goes down the line, and that's exactly what happened. I ended up having all 5 toes operated on. This is 3 years later, and my foot is mangled. That's the only term I could use. It's mangled.
Her case is a perfect example of the worst case scenario where things have really gone wrong for her. She is an example of what we have seen for patients who've had this elective operation for cosmetic purposes, ending up with these horrible consequences.
Trying to regain some sort of active lifestyle, Mary has turned to orthopedic surgeon Dr. Mark Meyerson. He says her only option at this point is to amputate her toes.
She's going to feel much more comfortable because the terrible bone pain that she's experiencing from the toe deformities will dissipate. In addition to which, we're able to provide her with a cosmetic foot, which is fabulous.
And looking at these images, it's really hard to tell which one is the normal foot or the prosthetic one. As for Mary, it has taken her a year to accept the idea of an amputation. She has this message for women who are thinking about foot surgery just for the pure beauty of it.
There's nothing that's simple about surgery, and especially on the feet, because your feet carry your whole body. And once you have something done to your feet, maybe you'll never wear those stilettos again. Maybe you'll never be able to get into those shoes if you decide to have surgery, and it turns out like mine.
Key thing is surgery, no matter how minor it may seem. And I can't stress enough, make sure the shoe fits your foot, not the other way around.